Hi, I'm Dr. Erica Jones, MD. I'm a board certified family medicine physician, and today I want to talk about something that affects millions of women but still doesn't get enough attention. I want to talk to you about how menopause impacts your mental health. And men, I don't want y'all to go anywhere. It's time for you to understand how your women in your life, how their mood is affecting their mindset. Mood swings, anxiety, and depression can show up during this time. And for some women, mental health symptoms are more disruptive than the physical ones. So let's break down what's happening during menopause and how it affects a woman's mind, and then what can be done about it. So I'm just going to start off with something real simple. What is menopause? We oftentimes will define menopause as the point in time when you haven't had a menstrual period for 12 consecutive months. That is typically how we define menopause. Symptoms often start during perimenopause, and that can start as early as the late 30s or early 40s for a woman. And during perimenopause, estrogen and progesterone start to fluctuate. These fluctuations directly affect your brain chemistry as a woman. So just understand that as these hormones change, so is a woman's mood going to change. Estrogen isn't just about reproduction. It also helps regulate serotonin, dopamine, norepinephrine, strong neurotransmitters that affect the mood, energy, sleep, and even pain sensitivity. Yep. It's important for you to understand that. So I'm going to give you some of the most common mental health symptoms that have been reported by women as they're going through perimenopause and menopause. I'm going to start off with irritability and mood swings. So be very nice to women in their 40s. They could be going through menopause. Depression can be another symptom. Anxiety or panic attacks could be another symptom. Even, let's talk about brain, right? Brain fog or like memory lapses. Then fatigue or apathy, poor sleep or insomnia. These are all things that women are having to deal with. So be very, 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 very nice. There's a study out that found that women are almost twice as likely to experience depressive symptoms during, perimenopause versus the time that they spent in their reproductive years. So it's important that we understand that this is a real thing that women are going through. And then some research is showing that there's links between the hormonal drops to increase sensitivity to stress, especially in women who have a prior history of depression or trauma anyway. So I'm going to talk to you about what's going on. Why is this happening? Estrogen decreases, right? So this disrupts serotonin and dopamine levels. Both of these are two major players as far as mood regulation is concerned. Another thing that happens during menopause is sleep disturbances. So from night sweats to hot flashes, these can lead to chronic fatigue and also worsen anybody's mood if you're not getting good sleep. So then you put on life stressors. A lot of women are caring for aging patients, navigating career changes, and even dealing with changing family dynamics. Menopause is not just hormonal. It's physiological, it's emotional, and it's situational. All these things, just imagine a woman having to deal with all of these things at one time. So first of all, you got to deal with your body changing, and then you have to deal with your mind and all the other things that's just disrupting your mental health in your life. There are some things that have been proven to help. So cognitive behavioral therapy, or CBT, that's proven effective for managing the menopause-related anxiety and depression. And you want to look for a therapist who's trained in women's health or midlife transitions. Usually when you are looking for providers and stuff, you can kind of see what they specialize in. You also want to make sure that you're incorporating some type of movement, because exercise increases the endorphins and reduces anxiety. Even, 30 minutes of walking helps. Even if you have to do mini workouts, you want to move your body. Talk about sleep hygiene, which is limiting the screens before bedtime. And then ask your doctor if you might need some short-term sleep aids as you deal with it. Nutrition matters. So leafy green vegetables, B vitamins, they're going to support your brain function and your mood as well. You also want to make sure you keep mindfulness at the forefront. Meditation and deep breathing are going to activate your parasympathetic nervous system, and that's your body's calming switch, right? So just make sure you understand that there's tools, right? A lot of people say people push pills on them, but sometimes medication is needed. We call those SSRIs or SNRIs. Those can be helpful for the mood swings and the hot flashes that are caused by menopause. Now, a whole nother topic is hormone replacement therapy. It might be an option for some people, specifically for people with severe symptoms, but it might not be for everybody. So just make sure if you're having trouble, you want to consider medication, talk to your doctor about the risk and the benefits. Now, as we move right along, I want to clear up a few myths as far as menopause and mental health are concerned. The first myth, it's all in your head. No. It's in your hormones and your brain chemistry, and that affects your entire body. Another myth, you're too young. No. Perimenopause can actually start in a woman's 30s. All right. The third myth, it'll pass. You could just push through it. Nope. You don't have to push through anything. Treatment and support exist. Ask for help. You can find a community or a support group, either online or in person, and just know that you're not alone. It helps to hear other people say what they're going through and to understand that you're not alone. I want you to know that if you are struggling emotionally or mentally and think it might be related to menopause, you deserve support. So track your symptoms, take them to your doctor, and advocate for your well-being. Another helpful tip, if your mother is still living, talk to her about the age that she started going through menopause and perimenopause. So that might give you some insight into when you might go through it. Now, if this video has helped you, make sure you share it with a friend, leave a comment below, and subscribe for more science-based wellness tips. I'm Dr. Erica R. Jones, MD, letting you know that you're not losing your mind. You're going through a transition. Menopause is a transition. Perimenopause is a transition. You are not alone.